Hi, my name is Stephen Nakata. I'm with the Urology Times, and we have a great opportunity today to be with Dr. Stacy Loeb from NYU, who really is an expert on Twitter and specifically on academics and research using social media. So, Stacy, what aspects of social media should all practicing urologists consider participating in?
I definitely think Twitter is the most important of the different forms of social media. Twitter is a micro-blogging service, so it's just very short tweets that are written about various topics. There are so many uses of this in urology. All of the major journals are on Twitter. Each conference has its own Twitter feed. We're here now at the American Urological Association meeting. Already there have been hundreds of tweets on the AUA14 hashtag. So if you're not participating as a urologist, I think you are missing out on a significant opportunity for education and networking.
Well, great. How do you incorporate Twitter and social media into your daily practice?
Well, the nice thing about Twitter is that all of the tweets are so short. So you pick who you want to follow. I follow all of the urology journals, the AUA and the other organizations, a group of other urologists, and a few things related to my hobbies like Syracuse basketball. And so my feed is completely tailored to my interests. It's people that I would otherwise want to hear from and news that I would read anyway. So instead of reading a long news story, I get to read a very short clip. So I think the key to this as a busy clinician is not to let it interrupt time that you would otherwise be working. So when you're at your desk at your computer, that's not the best time to be using Twitter. I try to incorporate Twitter when there's dead time, waiting for a bus, in line, waiting for coffee, times when otherwise you would get nothing done, and now you can actually hear about new research and interact with your colleagues during what would have been completely wasted time.
How do you think it's helped you in your practice?
I think there's a lot of ways. The research aspects are very interesting. Every time someone comes out with a new paper, it goes up immediately on Twitter. So as someone who's constantly writing new papers, it's very helpful to have all kinds of new references. And there's great discussion about these papers, very nuanced discussion among urologists, which is very nice to inspire new research ideas. If there's a paper that comes out that has some flaws or some future directions, all of that goes up on Twitter, and it's very inspiring. It's also actually helped me make a lot of new friends and contacts within urology. I just found this app called Tweeps Map that shows you where your followers are from, and mine are from 67 different countries, which is just amazing. So I have met so many people. I have people coming up to me all day at the AUA here saying, "Oh wow, I met you on Twitter. It's nice to put a face to the Twitter handle." So I think that it's really a nice way for all urologists to get to know people who have similar interests from all over the world.
Well, what about some of the other forms of social media and even TV and radio? How does that all tie in?
Absolutely. Well, I also host a radio show called The Men's Health Show on Sirius XM. So if anyone's interested, that's Wednesday nights on Channel 81. And we discuss a lot of men's health issues. So on that radio show, I do try to get all of the major research articles. Anytime a guideline comes out, we have the authors of the guideline come on. So I think that the media is an extremely important aspect to practicing medicine. In fact, if we don't disseminate the findings and discuss with the public all of the new research and guidelines, then we would be doing a disservice. So rather than some kind of distraction or fluff, I think it's actually critical, because the real impact of our work is only through the dissemination to patients and the community.
Well, do you think, how much does it help your department?
I think that social media is very important for a department. NYU has a Facebook page with updates about people in the department. We also have an active Twitter feed. I think that other urology departments should do the same thing. If they have people in the department who are presenting at the AUA, who have an interview in the newspaper, if they're hosting a course or a support group, social media is a great way to spread the word, because people who are interested in you and in your interests are the people who will follow you. So it's nice to be able to tell them about things that they probably will be interested in.
Now, should urologists and departments do this themselves, or should they hire specialists, or what are your
Well, I
thoughts
think
on
it can be some of both. I definitely think that all urologists should learn how to use it, because it's hard to even work with a specialist if you're not familiar with it. I can say I know a few urologists who have specialists working for them, but they don't actually know how to use it, and they miss out on some of the interaction that's possible through Twitter. So if somebody mentions them or mentions some of their work, it's important that that urologist actually sees that interaction so that they can respond directly to somebody. And that sort of personal interaction is what makes it social and what makes it build networks. So it is useful in terms of marketing and general strategy and learning how to use it to have somebody do this. It also can be time consuming if you were doing it for a whole department, not just yourself, and you were trying to post updates of every person in a large department. Something like that would be nice to have somebody who is a true professional doing this. But certainly it is possible for individual urologists to be good at it, and you don't have to follow a lot of people or do it for tons of time every day. Just slowly start to integrate it, and I think that you will see real advantages.
Oh, that's great. Can you tell us a little bit maybe about the do's and don'ts of Twitter?
Absolutely. So there's actually a few codes of conduct, which is something important that I would recommend that all urologists read. The AUA has a social media code of conduct, as well as the BJUI. Both of these really emphasize how it's important to always stay professional. You should not disclose any confidential information about patients on Twitter, because that can be read by anybody. So this is a permanent record. So you should always go into it with the thought that this could be available to anybody forever. So you would not want to post any pictures of parties or anything that would be considered as unprofessional. But that guideline really isn't so strict. I mean, you can still crowdsource things to your contacts on Twitter. So if you have a patient type of question without disclosing anything confidential about the patient, you can ask advice. For example, if you had a patient who was concerned about BRCA and prostate cancer, but you don't know about that topic, you can post on Twitter, does anyone know about the link between BRCA and prostate cancer? And likely you'll get at least 10 replies within several seconds, including links to articles and real experts weighing in from all over the world. So it's a great way to phone a friend, but it is important to do that in a way that doesn't give away any confidential information about an individual patient.
Oh, that's great. Tell me about the hashtag symbol and how we should use that.
Absolutely. So hashtags are everywhere now. It's basically just putting the pound sign in front of a word, and that converts it into a keyword. So anything that is a search term or a keyword in your tweet, you should put a hashtag in front of it. For example, my research is on prostate cancer, so if I'm posting things about that, it would always have hashtag prostate cancer. That way, if somebody searches Twitter, which thousands of people do every minute, and they want more information about prostate cancer, they will come up with any of the tweets that use the hashtag prostate cancer in that search. Similarly, that's also very useful at meetings. So if you are trying to look at the proceedings of the AUA meeting, here we are, there's several sessions going on right now in different rooms. If I would like to go back through and see what I missed this morning at the AUA, I can just simply look down the feed using the hashtag AUA14. So it's a great way to get very focused information if you're a consumer of Twitter, and if you're a user, to make sure that your information reaches the people who are most interested.
Now, you mentioned earlier that you have followers from over 60 countries. Can you tell me sort of who your followers are? Are these mostly physicians, patients, customers, friends? How does that break down?
They're everybody. Most of them are urologists, nurses, other healthcare providers. There's a lot of people from the press. It's really just a very diverse group. Some people, it's not really clear why they're following you. It could be that they have a history of a urological cancer, but that's not obvious from their profile. So I think as long as you keep everything professional, it doesn't really matter who they are. If you post good content, which is one of my main tips. I think it's very important to focus on the quality of the content that you post. It's really about being parsimonious. That is my key to success with Twitter, is being parsimonious, not just posting extraneous commentary all day. These urologists in Australia or South Africa, France, they don't want to hear that I just ate a sandwich for breakfast, or the water isn't hot enough in the hotel room at the AUA. What they're interested in is real content. So if you're sitting in a session and somebody comes out with an interesting new piece of data, Dr. Klotz shows the long-term follow-up of active surveillance with a picture of the curve that was shown in the presentation. Someone remotely really is getting some actual quality information through that. So my best advice to people starting out is to keep it parsimonious and reserve your tweets for things that are important, that your followers would really want to know.
Great. Now, you've already mentioned AUA, and organizations and publications are also involved. Can you tell us a little bit about maybe some of the best groups to follow, or organizations to follow, and maybe how they can do a better job?
Right. Well, all of the major urology organizations are on Twitter, so the AUA is important to follow. They have all kinds of updates about this meeting and all their other programs. Same thing with the EAU, USANS, so all of the major societies. The journals all have a presence on Twitter. The BJUI and European Urology are very active in Twitter. In fact, the BJUI even has a social media awards ceremony now every year to congratulate the urologists who make the greatest contributions to the field through Twitter. So it shows that some of these groups really are embracing this. There's a lot of urologists on Twitter, ranging all the way from trainees to many chairmen. So it's a great way for trainees and younger people just starting out to get to interact with some of the leaders in the field, really with a level playing field. Everybody is just the same on Twitter.
You know, we've talked a lot about the idea that mostly younger people are using social media rather than older. Why do you think that is, and is it changing?
I think so. I think a lot of people of all ages are now getting into it, certainly because it wasn't around until more recently. People who grew up many years ago weren't used to using this growing up, and now kids today are. So I think it's just a function of when it came out. Twitter just started in 2006, at which time it had less than 30 healthcare professionals on there, and now there's more than 75,000. So people of all ages are starting to embrace this.
Now, if you could only focus on one of the products or aspects of social media, which one would you recommend?
I think following conferences and emerging research on Twitter is the most important for me as an academic urologist. It's a great way to stay up to date on everything that's happening, both in journals and at conferences. We're all busy. I can't go to every meeting, even though I would like to, and there's often overlapping sessions at meetings, so it's nice to never feel like you're missing out on anything, because if there is an important paper or there's something important at any urology conference, I feel very confident that I will know about it because of Twitter.
What do you think the future holds? What's the next Twitter or the...
Well, I think that all of these forms of media are going to continue growing significantly, and one thing in the future may be actually using the data from Twitter and Facebook for research. There's some new research coming out where people are using Facebook interests and correlating it to things like obesity. Twitter has been used for surveillance and epidemics around the world. I think this is very intriguing and something that urologists haven't tapped into yet. So my future prediction is not only will the use continue to grow at conferences and greater applications in our field, but we may also start seeing some published research that is actually using all of this publicly available free data for research.
Great. Now, who do you think benefits most, from Twitter?
I think you do. I think we all do. I could say that I feel that I have had a substantive benefit in terms of research inspiration, meeting new colleagues. I think that it has great benefit to anyone who uses it.
I think, want to thank Stacy. That was a great interview,
you.
a lot of great information, and I think we've all got to get updated. If you're not on Twitter, it's time.